record at 124. And we are going back to item number 18, Bill 613, AB 613. So Roseanne.
Yes. So AB 613 is sponsored by the author, Assemblymember Lowe, and it has to do with regulatory fees for boards under DCA. It would allow the board to increase any of its authorized fees once every 4 years by an amount up to the consumer price index for the preceding 4 years. Under existing law, it's specified that the percentage change in the cost of living is defined as the percentage change from April 1st of the prior year to the April 1st of the current year by the change in the California Consumer Price Index for all items as determined by the California Department of Industrial Relations. The board, as we discussed earlier, sets fees, maximum fees in statute, and then the fees that we're actually charging are specified in regulations. So currently, if we want to change those, it requires either a statutory change if we're at the maximum amount, or a regulation change if we're not quite at the maximum amount yet. That's the current process. And so under this bill, the board would be allowed to increase fees by the CPI every 4 years. A board seeking to increase the fees by the CPI would have to provide its calculations to the director. The director would approve the fee increase unless there were certain conditions present. They could disapprove if the board had unencumbered funds equal to more than the board's budget for the next 2 fiscal years. The director could also disapprove if he or she felt that it would exceed the reasonable cost for the board to administer their programs, or if the director determined the fee would injure public health, safety, or welfare. The bill specifically does state that the fee increased by the CPI is not subject to the Administrative Procedure Act, meaning it's not subject to the regulatory process, so it could be done separately from that process. The reason that the author is seeking to run this bill is that he notes that because legislative or rulemaking processes are so lengthy and cumbersome and staff intensive, boards tend to delay raising fees until they absolutely have to. And then when they do end up doing that, then the changes are often large and tend to be more controversial. So they believe that allowing this to adjust by the CPI would allow a more modest increase over time. Currently, it's about a 1 to 2 year process to change fees either by regulations or by statute. So it does take a significant amount of time and staff time. The Department of Industrial Regulations provides a calculator for the California CPI on their website. So I took a look at the calculator just out of curiosity to see for the past 2 sets of 4 years what the increases would have been. I showed that in attachment A, but just for informational, for the past 4 years, April 2014 to April 2018, it would have been 10.3%. And then April 2010 to April 2014 would have been 8.3%. So the board's fees vary depending on license type and the service being provided. So, for example, renewal fees are about $75 to $175 a year. Initial license fees range from $80 to $200. California Law and Ethics exam is $100. So it would allow a modest increase, about 10% for the past 4 years tacked onto that. And of course, we mentioned earlier we're doing a fee audit right now and are going to be talking about fee increases at the August Policy Committee. It's doubtful that would let us, that this is not going to, if this bill were to pass, it's not going to avoid us needing to raise fees probably this coming time, but it might help in the future for extending how often we have to do it. At the April Policy and Advocacy Committee meeting, the committee recommended the board consider taking a support position on the bill.
So just to clarify, that's not going to impact our current process that we're looking at in terms of our fee structure?
No, it could, if the process for whatever reason gets delayed a little bit, it could allow us to bump it up if the bill were to pass. We might be able to do a small increase to hold us over to keep our operations going. But it's not a long-term solution right now.
Christina and then Peter.
So Roseanne, do we know when the implementation time is going to be? What year that it will come into implementation?
If the bill passes, it would become effective January 1st.
January 1st,
Of
2020.
2020, this
Wow.
coming January 1st. We wouldn't have to do it, but it would be an option.
Any further comment from the board? Is there any public comment on this issue?
I'd like to make a motion.
Whoops,
Oh, it's about.
Oh, sorry.
Rebecca's coming up.
Never mind.
Rebecca Gonzalez, National Association of Social Workers. Just a question. What would the process be for public input if this bill passed?
The board would have to, we would calculate what the CPI was. We would have to take it to the board to approve it.
Okay.
And then we would have to submit it to the director.
Okay, so it'd
For
be in an
approval.
open board meeting and because, I had received some correspondence from the Medical Association that
Yeah.
are opposing it. And so I'm
And
just
I
looking at
ran
their letter.
your concern by, I let
Uh-huh.
Assembly BMP, who's running the staffer over there that's running the bill, I let him know about that concern. But
Okay,
we would have to go through the board, so the
Okay.
board would have to approve it.
thank you.
And Leah?
I'd like to make a motion to support and recommend that staff make any non-substantive changes if it's relevant.
I second that.
Any further comment from the public? Or from the board? Christina?
Yes. Yes.
Yes.
Yes.
Yes.
Aye. Yes.
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 All right, so Roseanne, AB 769.
Yes, AB 769 is authored by Assembly Member Smith, and the sponsor is the California Association for Licensed Professional Clinical Counselors. And this bill would allow Medi-Cal reimbursement for covered mental health services provided by a licensed professional clinical counselor employed by a federally qualified health center, otherwise known as FQHC, or a rural health clinic, otherwise known as an RHC. Under existing law, it establishes that FQHCs and RHCs services are covered Medi-Cal benefits that are reimbursed on a per-visit basis. It defines a FQHC or an RHC visit as a face-to-face counter between a patient and a specified list of professionals. It can be a physician, for example, a nurse practitioner, a psychologist, a licensed clinical social worker, or a marriage and family therapist. LPCCs, being our newest license type, have not been included in this list. So the bill proposes adding LPCCs to one of the eligible providers. The author notes that currently there's about 600 FQHCs and 350 RHCs in California. They serve uninsured and underinsured people and are reimbursed by Medi-Cal. Them not being able to get reimbursement for LPCC services creates a disincentive to hire LPCCs, even though they are also capable of providing the services. So the sponsor also states that adding LPCCs to the list will help increase, they will increase provider types to meet the demand for mental health services, especially in rural areas. Marriage and family therapists were the most recent addition to the list. The Camped ran a bill, AB 1863, that was signed into law in 2016 that added marriage and family therapists to the list. The board had a support position on that bill. There was a very similar bill to this run a couple years ago, also by CalPIC in 2017. It was actually identical. The board had a support position on that as well. However, the bill was vetoed by the governor. He noted that the Department of Healthcare Services was at the time developing a new payment model for the health clinics that would eliminate the need to specifically add different types of professionals. So he said that the bill was unnecessary. The sponsor notes at this time that the new payment model that was being worked on that the governor referred to ended up not being approved. And in 2018, that project was terminated. So the bill is still needed again. And the Policy and Advocacy Committee recommended the board consider taking a support position on the bill. And CalPIC was unable to be here today, but they did email me a statement that they would like me to read. This is from Kenneth Edwards, their director. He says, CalPIC thanks the board and the supporters of AB 769. This bill will do a great deal to help the populations that we serve to have access to services in areas where they did not have them before, and it will also open up job opportunities for counselors in those affected areas.
Great. Any comment from the board? Public comment? Do we have a motion? Leah?
I move to support and invite the staff to make any non-substantive changes if necessary.
I'll second that.
Okay. Any further comment before we call for a vote? Okay, seeing none, Christina?
Yes. Yes.
Yes.
Yes.
Yes.
Aye. Yes.
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 All right, Roseanne, Bill 1145.
Oh, it's turned off. Sorry. And Assemblymember Garcia is also the sponsor of this bill. And this is a bill that we've seen for a few years in the past. It would specify that voluntary acts of sodomy, oral copulation, and sexual penetration are not considered acts of sexual assault that must be reported by a mandated reporter as child abuse if there are no other indicators, or if there are no indicators of abuse, unless it is between a person aged 21 and older and a minor under age 16. So existing law, as we know, establishes the Child Abuse and Neglect Reporting Act, otherwise known as CANRA, and that requires a mandated reporter, which includes our licensees, to make a report in instances in which he or she knows that or reasonably suspects that a child has been the victim of child abuse or neglect. The law goes on to define sexual abuse for purposes of CANRA as sexual assault or exploitation, and then it further defines sexual assault as including rape, statutory rape, incest, sodomy, oral copulation, sexual penetration, or child molestation. So that's the definition in question there. The author's office is attempting to clarify law due to concerns and feedback that the requirements for mandated reporters of child abuse are confusing, inconsistent, and discriminatory. Some mandated reporters interpret the law to read that consensual sodomy and oral copulation is illegal with anyone under 18, and that it requires a mandated report as sexual assault under CANRA. They argue that the same reporting standards do not apply to heterosexual intercourse. There's contradictory opinions that the law does not read this way, and that these types of sexual acts are not treated differently as other acts under the code. But the bottom line has kind of become that a lack of clear understanding leads to confusion about what is reportable and what is not. Mm-hmm. And mandated reporters need to be able to know because it's very serious. Mm-hmm. And therefore, the author is trying to make some clarifying changes. Mm-hmm. The board first examined this issue in 2013 when stakeholders expressed concern about it. At the same time, after a presentation at the board, staffers at the legislature contacted the board to caution that there had been past legal interpretations stating that the this interpretation of CANRA was incorrect. It could have consequences outside of just the change being proposed. The board was concerned about a legal misinterpretation of CANRA, but at the time they saw it as a valid effort, and therefore staff was directed to obtain a legal opinion from the DCA legal office at that time. The DCA legal office did issue a legal opinion. It can be found in attachment A here. And DCA found that CANRA does not require a mandated reporter to report incidents of consensual sex between minors of a similar age for any actions described in Penal Code Section 11165.1 unless there's a reasonable suspicion of force, exploitation, or other abuse. And in coming to this, they relied not just on the strict reading of the law, but also on court cases that would not be clear to somebody that was just simply reading the law. It has to do with the way courts rule in different cases. So that's how they came to that. The Board of Psychology then, after DCA's legal opinion, sought an opinion from the Attorney General's office. And they asked for clarification on the issue under discussion today, and also they asked for clarification about sexting between minors of a like age, and is that reportable? And some questions about a mandated reporter relaying third-party reports of downloading or streaming child pornography. So that request has been submitted to the Attorney General's office by Assemblywoman Garcia. She submitted that in February 2015. However, unfortunately, the AG's office is unable to issue an opinion because there is a related court case currently underway. And so the opinion is suspended until that litigation is concluded, and there's no timeline of when that may occur. So we don't have an ETA of when we might get that ruling from the AG's office. The author has made 2 past attempts at clarifying the issue. In 2014, the author ran a bill. The Policy and Advocacy Committee recommended the board take a support position on the bill, but the bill died before the board could take a position on it. And then again, AB 832 in 2015 was very similar to today's bill. The board took a support if amended position at that time and asked for an amendment clarifying that only non-abusive sexual conduct would not be reportable. The author made that amendment, and that amendment is still in the language that you see today, so that is there. But AB 832 died on the assembly floor. At the April 5th of this year, the Policy and Advocacy Committee meeting, the committee discussed the bill and recommended a support position. The committee also directed staff to reach out to the author's office to discuss the possibility of also clarifying reportability of filming, sexting, or similar use of technology between minors, because the committee noted there's also a lack of clarity there. So I did reach out to the author's office. We've talked a couple of times between now and then, between then and now. The staffer that I spoke with that's running the bill, she indicated she would discuss the idea with members and other stakeholders, but they are having a problem with getting the bill through the Assembly Appropriations Committee. The deadline for it to get through the committee is next week. They're going to make a decision on it next week. She's definitely said that that they're open to considering amendments if the bill gets out of committee. CPA had asked for a similar clarifying amendment as well that this board's committee did, but that she was also hopeful due to the kind of sensitivity of this bill and the issues it's having getting it out of the committee, that she was hopeful that the board might support the bill in its current form as well, because it does solve a problem that exists. So that's kind of where we're at now. We'll know next week more whether the bill is going to move this year or if it's going to become a 2-year bill. So that's kind of where we're at now.
Leah?
A comment and then a question. The first piece, I just want to state, I guess for the record, that even though different bodies are interpreting the law the way they want to interpret it right now, who's going to be in office 10 years from now, we don't know. And as we've watched over time political forces wax and wane, I think it's really important to have specific laws that protect what primarily this is for LGBTQ individuals. So I think that it's very important that they do this, and I totally support it. The second piece is, I'm curious, Roseanne, what is the hesitation of why it's died? Is there a consistent reason other than the lame, it's not necessary because it's being interpreted in a way?
I've never been able to exactly get to the bottom of why it keeps dying. There's just there's a long history with this at the legislature. There's been a lot of legal opinions, I guess, there's been a lot of conflicting legal opinions. So I think that the fact that nobody's really sure, there's a lot of conflict. They just haven't been able to get the support in order to pass it. But it just doesn't get the support of the legislature that it needs to get through.
I hope it's not bigotry.
Max? Maxwell.
Well, to echo what was just said, I think it would be interesting to know a statistic how many times the law is being misinterpreted to be used in a certain way. And like you were saying, actually, I would say for the cases I'm dealing with, my LGBT center, the majority, like 99% of the times, is the parent that is rejecting the consensual relationship between their minor's kid. They have a kid that is in a relationship with another kid that happen to be LGBT, and the adults intervene to stop that. And I had cases of child abuse reported and misinterpreted by the police that intervenes to begin with, so because they're called for it. And there is incredible dramatic consequences. The youth had to endure just because of the adult's intervention. That is not to benefit the kids whatsoever. It's their interpretation of how another kid might turn their kid gay or trans or whatever based on their consensual relationship. It's never been brought a case where there was actual child abuse. And in interpretation, it's always applicable to queer kids. And it's very terrifying because it's been penalizing experience for our LGBT kids. And there are millions of reasons why this has never moved forward, because there are a lot of forces that are afraid or concerned that this could limit the freedom of interpretation of relationship based on religious idea of what it's abuse or what's not. And therefore, there are a lot of folks that have a hard time to take the stand in favor. But the law is very clear. It's very clear that's not child abuse, but it's been interpreted by the law enforcement in many different cases in different ways, and that's really has been very detrimental. So I definitely am in favor for the bill.
Any additional board comment? Public comment?
Kathy Atkins with CAMT. We supported the rendition of this bill in 2015. We worked with the author and the sponsors in great detail to work on the language so that, to the best of our ability, we avoided unintended consequences, and we are in support of this bill this year as well.
Rebecca Gonzalez, National Association of Social Workers, we're also in support of this bill.
Hi, Jerry Grossman, MFT. In terms of the bill, first of all, it would eliminate the idea that somebody who is engaged in consensual intercourse, a minor with people of similar age, that's not reportable, but the current setup of Penal Code 11165.1 is that if a minor is engaged in consensual oral sex or anal sex, then it is reportable. So in essence, it's homophobic, the setup of the law. In terms of our profession as mental health professionals, most mental health professionals are not reporting consensual oral or anal sex, so they are choosing not to follow an existing mandate. And it's a slippery slope for mental health professionals to decide which mandates they want to follow and which mandates they don't want to follow. And so the clarity that this bill would provide would be that everybody understands. There are mental health professionals, upon the recommendation of Kampf in an article that Kathy wrote, saying that the conservative approach is actually to make the reports. So there are therapists, a minority of therapists, who are making the reports. So the consequence of this is that it harms the therapeutic relationship on these consensual sexual acts. And there is a possibility, as you alluded to, that these people could then become sex offenders, and that would affect their lives significantly in terms of getting a job, in terms of getting housing, etc. So that's the effect on the therapeutic relationship. So with those things in mind, I ask the board to support AB 1145.
Thank you. Do we have a motion?
Well, I'd just like to add, I think,
Oh,
too.
sorry.
I would just like to add, too, in support of the bill, that it not only protects kids in the LGBTQ community, but it also protects kids who engage in heterosexual activities that would be considered sexual curiosity or alternatives to intercourse. I mean, there's lots of trainings around, what are the things you can do outside of intercourse. And so, of course, oral sex is one of them. And so I think it protects developmentally fragile kids who are experimenting to see what they like and don't like. So it protects both that community, but kids in general, minors in general, who may stray into this realm, and it protects them for the very things that Jerry Grossman mentioned. So it's a very important bill.
I would like to make a motion to support this bill and to direct staff to make any substantive changes. Non-substantive changes.
I'll second that.
Not substantive changes, thank you.
Max has this, you had the second, right? Any additional comment from the board? From the public? Let's call for a vote. Christina, please.
Yes. Yes.
Yes?
Yes.
Yes.
Aye. Yes.
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 Thank you. AB 1540.
All right. So AB 1540 is it's authored by Assemblymember Holden, and the sponsor is the Certification Board for Music Therapists. And this bill seeks to define music therapy in statute and to provide guidance for consumers and agencies regarding the education and training required for a qualified music therapist. Right now, several state agencies define music therapy in their regulations. The definitions can be inconsistent and refer to outdated entities. The most recent instance of it being defined in regulations was the California Department of Education's regs. They adopted those in 2014, and they utilized the Certification Board for Music Therapists definition and recognizes their certification credential. Other areas where it's defined are in regulations for licensing and certifying health facilities. The Department of Mental Health has a definition, and Public Health has a definition as well. There's some variance in the definitions. Some of the credential agencies mentioned don't exist anymore, so there's some inconsistencies there. This bill would establish the Music Therapy Act. It states that the intent of the legislature is to provide a statutory definition of music therapy and to enable consumers and agencies to easily identify qualified music therapists. It provides a definition of music therapy. It provides a scope of practice of music therapy. It defines what music therapy interventions are. And then it goes on to prohibit somebody from referring to themselves as a board-certified music therapist unless the person has completed a number of different steps. need to have earned a bachelor's degree or equivalent or higher from a music therapy degree program approved by the American Music Therapy Association. And then they have to complete at least 1,200 hours of supervised clinical work. Once they complete the certification requirements established by that, they can get the Certification Board for Music Therapists credential. The bill also states that the act does not authorize someone engaging in music therapy to state or imply that they provide mental health counseling, psychotherapy, or occupational therapy. And the use of music therapy does not imply or suggest that a person is a board-certified music therapist. The bill states it's an unfair business practice for the person to use the board-certified music therapist title unless they actually hold the certification. And it states the bill shall not be construed to require a music therapist currently employed by the state of California to obtain certification as a music therapist if they're already employed by the state. So the author's office, of course, notes that there's the inconsistencies in law, and they're trying to make things clearer. They point to the two current organizations jointly involved in the certification process for music therapists, the American Music Therapy Association, which credits the degree programs or approves the degree programs and the training requirements, and then the Certification Board for Music Therapists certifies music therapists to practice nationally, offers a credential, it administers an exam, it has a certification that's valid for 5 years, and then they also have a code of professional practice. Together, those two entities have jointly developed a definition of scope of practice of music therapy, and that can be found in Attachment A. Music therapy is a single specialty of recognition. It's one of several subtypes of specialty therapies. Many of these therapies have an independent certification board, and they'll issue a credential if specified requirements are met. Examples of other types of this are dance movement therapy, and art therapy, and music therapy. The bill contains language stating that the use of music therapy is not restricted to any profession, so the board's licensees, if they're already utilizing music therapy in their practice, they can continue doing so as long as they're not stating that they're board-certified music therapists, unless, of course, they actually are, then it's fine. And it protects the board's practice acts with the statement prohibiting mental health counseling or psychotherapy unless you hold the appropriate license. This bill, or a very similar bill to this, was run in 2015, but that bill was vetoed by Governor Jerry Brown, and so it did not move forward. And so they're trying again, new governor, new year, they're trying again. The board was neutral on the previous bill in 2015. At the April Policy and Advocacy Committee meeting, the committee considered this bill and also recommended a neutral position to the board. So that's where we are today, and we can open it up for discussion. Oh, I will note that you will see that there is an entity that's opposing the bill right now. The opposition appears to have been removed. It was a concern about the state not being able to. The opposition didn't want the state to require people that were already working as music therapists for the state to go back and have to get this credential, and so that's where the carve out about not requiring state employees to do that was added in.
Any comment?
I agree with the P&A committee's decision. It doesn't really affect us directly, and they have their own scope and don't know enough about it to have an opinion. Yeah.
I think, though, it goes along the principle of making sure that people that are, out there by self-proclaiming to be therapists or music, a lot of people don't know the difference between one and the other. I think this will clarify a little bit about the responsibility under which organism they're regulated by, because there is a lot of people really don't know in general what music therapy is all about, I was introduced to that like 5 years ago. But some folks might think it's therapy with music or, vice versa. So there is a lot of interpretation. I think this will really help to clarify. So I'm all in favor for this, to have an opportunity to making sure that there is clarification of responsibility and so on and so forth.
But Max, are you saying you think we should take a position, or are you just comfortable being neutral?
Well, either way, I think though not taking a position might just kind of like being neutral. Perhaps in a situations like this could be kind of like it's not affecting us. In reality, it might affect us with the same idea of thinking about a regulated licensee that in one way or another is reflected upon us, because people don't really distinguish the responsibility between one license and another, having some identification that could point that out. Actually, in reality, I think it does benefit us as well. So I would like for the board to take a position. So, yeah.
And at the risk of disagreeing, I have concerns about us supporting it.
Okay.
Only because I think there are implications and statements related to the field in general and the practice in general that I think by taking a support position, we're basically signing on to the purported evidence-based practices and a lot of the other language that's in here that I don't know that we would actually support if we really looked at it in depth. I think by taking a neutral position, we're not necessarily agreeing to the content of the field itself. So the field itself is, I think, fraught with questions, and I think that taking a neutral position is I would recommend that position from my personal standpoint. Christina.
I'm trying to recall the reason why we tried to, we chose to be neutral last time was really because, one of the reason was, how music therapy relate to the mental health field. And so I think, since this is one of these specialties, just kind of maybe further elaborate what Betty say is that, if we support music therapy, then there are many other specialty, that will kind of create, some disparity if we support one and not support the other. And so I think it's, it looks like, for the content of the law right now, it doesn't have, a whole lot of correlations with, the mental health field. So I think, it's pretty safe that, we just watch and, and see how it goes. But, and so Roseanne, my question now is that, looks like it is in the third reading for this bill. So what is going to, what do you, what do you think is going to happen if you have the crystal ball?
So it's in the third reading. It'll go for a vote in its originating house. That needs to be done by the end of the month, and then if it passes the floor vote, which it likely will, then it will go to the Senate and then go through the same process there. So it's about halfway through.
Any further discussion? Leah?
So if we decide not to take a position, we just move on to the next item? Is that?
So we don't need a motion to take a
No.
neutral position.
I'm
Matt?
not going to. I was pretty open to the idea. I wanted to see also the conversation that was had before. I'm not an expert in the field, but definitely I wanted to make sure that, to me, in reading the bill, it clarified a lot of things about the need, why it should be there. But in terms of our position, I'm okay with a neutral position, but I wanted to hear more from the committee, especially from the conversation that you had in that contest. So if there is more to it, I will appreciate it too, because, okay, that was it. So if we don't have a motion to support, we don't need to vote, right?
I'd like to hear is there any public comment on this issue? No. Then I think unless there's any additional comment from the board, I think we're going to move on.
Sabina, are you okay with that?
No, I'm saying unless Roseanne wants them to be official, they're neutral.
I don't think, I
Position.
mean, the neutral, we don't send a letter. It's the same
Right.
as no position. It's like we never
Right.
talked about it.
Okay.
So,
So it's
I would
fine.
just say we don't need one.
So next is S. Bill 10, Mental Health Services,
Which one? AB 16.
page 263.
What's the one after? What's the number?
Okay. So the next bill is SB 10. This is the bill, a similar bill was run a couple years ago, or actually last year by a Senator Bell, and it has to do with peer support specialist certifications. It's got several sponsors, including the Steinberg Institute and the Los Angeles County Board of Supervisors. And the bill would require the State Department of Healthcare Services, or DHCS, to establish a certification body for adult, parent, transition-age youth, and family peer support specialists. It also requires DHCS to amend the state's Medicaid program to include these providers as a provider type within Medi-Cal. The bill would define peer support services, and it would also require establishment of a certification body by DHCS. The certification body would need to define responsibilities and practice guidelines for each type of peer support specialist using best practices and to determine specific core competencies and curriculum, including things like cultural competence training, trauma-informed care, co-occurring disorders of mental health and substance use, and things like confidentiality. The certification body would specify training requirements, establish a code of ethics, provide minimum requirements for the various types of peer support specialists, the typical certification duties and things that are required when you establish a new program. The bill also states that the act does not imply that a certification holder is qualified or authorized to diagnose an illness or provide clinical services. It says that it does not alter the scope of practice for a healthcare professional or authorize delivery of services in a setting or manner not authorized under the Business and Professions Code. If this bill were to pass, DHCS would need to establish the certification body, run regulations, establish certification fees, and it would be allowed to implement this via notices, plan letters, bulletins, until regulations are adopted. Regulations would need to be adopted by them by July 1, 2022. So according to the author, the goal of this bill is twofold. They want the certification program to be established, and then they want increased family support and wraparound services to be the result. The author notes that California lags behind the rest of the country in implementing a peer support specialist certification program. The Department of Veterans Affairs and 40 other states currently have or are in the process of establishing such a program. So a couple of things that I pointed out either in previous years when this bill ran or we discussed at the Policy and Advocacy Committee meeting. The bill contains language that excludes providing clinical services from work that peer support specialists are qualified or authorized to do. The board might wish to discuss whether that language is sufficient or if you would like to suggest a more extensive definition. There's an example of a more extensive definition carving out our practice acts that we have suggested for similar types of bills in the past. So that's there on page 267. The bill does not mention supervision requirements right now for peer support specialists. Past versions of this bill did. Apparently that was an oversight by the author's office. The board may want to recommend that LMFTs, LCSWs, and LPCCs be specified as acceptable supervisors. I will note that last year they were, except for they left out LPCCs because they referred to a regulation that was old and did not include LPCCs because they did not exist. So I know that that's a concern of CalPICS. And then the final thing is fingerprinting is not required for certification under this bill, and that had been a concern of the boards in the past. previous legislation, last year, SB 906, the board had a support if amended position on this bill. It was very similar, but it did include a supervision component. The board asked that the author amend the bill to include LPCCs, and then the author also wanted to have a fingerprint requirement included. SB 906 made it all the way through the legislature last year, but the governor vetoed it. The governor felt that they needed to do some more work on the bill and also to ensure that existing peer support specialists would be able to qualify for certification under the bill. The Policy and Advocacy Committee discussed the bill at its April meeting. It recommended the board consider taking a support position, and it directed staff to discuss the concerns that I just mentioned in items 3 to 5 with the author's office. I did do that, and they had some feedback for me on that. The scope of practice exclusions, their staff shared a willingness to consider the language expressed in our packet. They didn't make any promises one way or the other. So the board may want to determine how essential it is, if the language that's as written is okay, or if we really want that paragraph included. The author's office indicated that the lack of approval or identification of appropriate supervisors was an oversight. And they were understanding of the board's desire for LPCCs to also be considered as appropriate supervisors with the other, with the LMFT and LCSW license types. And then the author's office, regarding the issue of fingerprinting, they indicated that they left fingerprinting out of the bill because they felt it might be discriminatory to some populations. And so they left fingerprinting out. They did note that although they did not include it in the bill, there's nothing in the bill that prohibits DHCS when they run the regulations for implementing that they could implement a fingerprint requirement in their regulations if they so chose, if they felt that was appropriate. So that's their stance on fingerprinting. So with that, I'll open it up for discussion. CalPIC, who's not here today, had a statement that they emailed me. They said, while CalPIC is supportive of the peer specialist bill, it is important to note that LPCCs are still not able to bill under the state's Medi-Cal program. Through multiple emails to agency directors, there has been little movement on remedying this issue. So that was their statement. With that, I'll open it up for discussion.
So I would like to start by saying I think this is a wonderful opportunity to standardize the certification process for many of these staff who are already providing this work in lots of systems of care. I think, unfortunately, without this clarity of certification, different community colleges and organizations are sort of piecemealing their own sort of training plan for them. So I think having organized and certified and sort of with core competencies would actually really serve the interests of these people with learned experience who are a critical asset in our systems of care, people who have lived through many of the challenges that they're going to support their clients with. So I think that's fantastic. And it also helps reduce the stigma of people who have had mental health services or been involved in certain systems. It really begins to target and support how we as a state are really offering people a way to use their life experience to benefit others. Which then ultimately sort of impacts and increases, hopefully, the health outcomes of all the clients that we serve. One thought I had in reference to supervision in particular is I'm wondering why the legislation is limiting it to licensed staff. In many organizations, licensed staff are a luxury. Many of them have staff who are working toward licensure. And so I'm wondering if it makes sense to look at opening it up to associates and licensed staff, because many times associates who haven't yet been licensed are still competent to supervise people who have lived experience, especially in these core competencies, since they're being supervised and trained and had this in their educational program. I know particularly where I work, due to the workforce limitations, many people are promoted through the supervisory structure who haven't yet been licensed. And so I'd hate to see people not be able to be certified or delayed because the agency that they work in have few licensed staff, and the ones that are there are being overworked. So that's just a consideration, but I think this is a wonderful opportunity for us.
So Roseanne, maybe this is for clarification. So currently, the eligible supervisor doesn't necessarily limit to just our licensees, right? I think it's open to.
They actually left it out. They need to add, last year it was added in. Right now it doesn't specify it at all.
Right.
So they don't talk about them needing to be supervised. My understanding is if the bill continues to move, it will be added in. That language from last year just didn't get transferred over.
So it will be adding that those, our licensees will be possible, the supervisor, but not limited, that they need to be supervised by a licensee.
That's what it was last year. Last year it was our licensee. It was anybody that was specified in a certain regulation that was put forth by I think it was DHCS regarding something else, and it included our license types, I believe psychologists too, but it left out LPCCs was the issue last year because the regulation hadn't been amended since like the 90s, and obviously LPCCs didn't exist in California in the 90s. So I had a pretty lengthy discussion explaining to the author's office about, rather than just pointing to a regulation that needs to be updated, it would be better to just list out the license types that exist now so that everybody got included and the names were used correctly, because it had the old MFT, marriage, family, child counselor reference in there too.
So I certainly, agree that, we need to, add the LPCC, into the, the possible supervisor list. But I also think that it's important that, it's not just the mental health. I mean, for the system now, I think the licensees definitely, would be, appropriate as a supervisor, but also it's important that, for the other people who work in the mental health field be able to supervise them. So as far as the supervision, I think that's okay with me. And I want to just, bring it back to, to the public too. The fact is that, working in the drop-in center, for the Mental Health Service Act, service, it's such an amazing thing, for our, coaches who have the lived experience. They're very excited the possibility, of having, the certification process, so that, it can serve as a foundation for them to continue on for their, career. And also, they're very excited about the possibility of continue to learn, just to really polish, their lived experience and, how it helped with a consumer. So I am definitely, in support of the bill.
I'm thinking about Jonathan's recommendation because I do agree it might be really difficult to hire a licensee even if they contract someone out. But I'm also hesitant about putting that on an associate because if it goes badly, then that associate, the complaint can go up to our board and it may be out of ignorance and now they've messed up their license because they're even too green. Because my thought when we did this before in the past with the licensees was if there are particular crisis issues or more often personality disorders, right? Because when you're not fully trained in that, all you know is there's something really annoying about this person, right? People often get triggered by people with personality disorders and that they might react with their own countertransference without knowing that's what's going on. So that's why I was thinking the licensees make it safe to supervise, and there's no ratios, so it could be one supervisor and 20 people if needed. I don't know. I'm just thinking this through out loud because I agree it's going to be a financial burden, but an associate, that makes me nervous. That especially somebody who struggles to pass the exam or has been an associate intends to be for the rest of their life, or I don't know.
I mean, I think that's a great point. But I think with that, we have to be just sensitive to agencies who, for whatever reason, can't hold on to licensed staff because once they get licensed, then they are able to be pilfered by the county or Kaiser or places who pay them more money. And so some of these agencies really just have staff who are fantastic. They're clinically sound. They just haven't been licensed yet, running these programs. And so I'd hate to see that we have to, or we're limiting it to just licensed staff, because that's just not a lot of agencies' reality.
I don't think that we have to. That right now there's no specification for supervision, so I don't think it has to be. You could just ask that whoever is supervising that our license types be included. I don't think it has to be. I'm trying to remember the older version of this. I don't think it was like some qualification under a regulation. It included our licensees, but it could be people other than our licensees. But I think we do probably want our licensees included, all of them, not leaving one out.
Correct.
Including maybe LEPs.
Because it might be in ERM settings.
Yeah, it's a possibility.
Possibility.
Because the teenager, that they have that peer support also. Yeah.
As a part of teams. Yeah.
So one of the points that I want to also bring out is the fact that, if we, if the author's office is open to include the language that we put in. So basically the peer support people, they are not performing clinical services. So they will be performing in clinical setting, but not the clinical services. So I'll, and like I said, I would be in support of them having supervision. With, our licensing's included. That's great. But if not, again, they are not designed to do clinical services. So it's kind of like touch on to our scope of practice, and yet it's not.
So you'd like to see? Are you saying you'd like to see the paragraph that's in there, and instead of what they had said, just not providing clinical services? Would you like to see the big, carve out paragraph added in?
Yeah. Oh yeah, absolutely, absolutely. I think the carve out paragraph is, really important to delineate, what not belong to them. So, but at the same time, I'm mixing that supervision, elements in it that, whether it should or should not be supervised by our licensees.
So, and I think to that point, if they are not providing clinical services, then it doesn't necessarily mandate that a licensed person supervise them, because they're not doing therapy, they're not doing counseling. I mean, they may be doing other navigation type services, linkages, and case management, which doesn't necessarily necessitate a licensed person. Your point well taken, Leah, but that could be another justification for broadening it to more of the licensed practitioners of the healing arts, the whole LAPA spectrum, including LPCCs, because we want to roll them in.
Yeah, I would like them to consider outside of licensees. Like, for example, I was thinking MSWs would be a great resource, right? They have training in running agencies and doing these type of things, but they're not seeking the LCSW, meaning they're not doing the clinical work, but they have the qualifications and the basic understanding. So yeah, it'd be really interesting to see what their previous law was about that. Because you also don't want just some stranger coming in off the street who doesn't have any training in mental health at all, with anything related to mental health. Like maybe they're a business person or whatever. That may not be a good fit, because we're still talking about, like, the purpose of the regulation is to protect the public. So we just want to make sure that whoever is supervising understands protecting the public.
So
I'm not sure how to word that.
So maybe that language around someone who has a master's degree in a counseling-related field,
mental health
related field. I mean, that sort of broadens it too.
So Roseanne, I must be missing something obvious here, because I'm not. Can you just refer me back to where it talks about supervision in this bill?
It doesn't at all.
It doesn't. They forgot.
Previously, they
forgot.
So you're talking about adding something about supervision. Okay, because I was
don't-
trying to go, where are you modifying this? Okay,
I
so you're
don't
adding it.
know
Thank
that-
you.
They're probably going to come up with their own parameters for supervision. They haven't done that yet, so I don't know what it's going to look like. I don't know if they're probably going to specify other license types, so I don't know how in depth the board wants to get into that or not. But I think is the minimum baseline is, do you want our licensees to be included or not?
If they start, okay.
Right, if they start doing that. I don't know that they're how receptive they're going to be to us. I don't know that they want us to necessarily craft the definition,
Right.
but do we want to be included or not? I think we want all of our license types included equally. We wouldn't want, for example, LPCCs to be left out.
So I think then what we're saying is that if they include us it wouldn't be, it wouldn't be a requirement that they have. It would just be that we would want to be
We want to
included.
have everybody included.
Does that sound what everybody's saying?
And my hesitation is without knowing what they want to put in supervision. Some people are clinic directors, they're business people, and that's what they know. And if they become the supervisor, then I would have a different feeling about this bill. So that's without any supervision language. You know, I don't know.
Does it make sense for us to wait until the language has come out and then be able to speak to it at that point?
It may be
would
too
we be
late.
given an opportunity? Maybe it's just too early because nothing's crafted?
The problem is that the bill, we don't meet again until September. So it'll be done. So I guess how, you could say support if amended to include a supervision component that includes our license types, but
Or
it's
other
impossible to-
mental health trained professionals or something like that.
Those that hold master's degrees and above of a particular.
I don't know if you'd want to get into that level of specification. I think that it's kind of, looking at the bill now, like how do you feel about it? Is it something you want to support? Do you feel like it's something you wouldn't want to support?
Do want to support it.
So
Definitely am in agreement with everybody that we need to support it. And my concern is that if we get too prescriptive with who can provide the supervision, that's going to eliminate a huge, it's going to compromise the greater good by trying it. While I absolutely value supervision and understand the need for it in a perfect world, that would be great. But I think we may sacrifice the good for the perfect.
right. I think you need to weigh how do you like what the bill does and how much do you like that versus how concerned are you about the supervision piece not being in there? Do you trust that the author will work it out? And I can provide I've already let them know that, that if they're going to include LMFTs and LCSWs, that LPCC should also be in there.
Yeah, Leah
and
then-
LEPs as well. I would just like for the voting purpose, I'd like to put actually all four of our licensees in that list. And then if we make a motion to support, which it sounds like we're leaning for you to work with the author and encourage them to make sure that however they language supervision for their own safety, for the safety of the public, for the safety of those staff workers, have some knowledge in the field, however they want to do that. But just to put that forth as a concern, not that it would make an effect on our decision. And Gabriel keeps putting his hand up, so.
I'm sorry, Gabriel.
No, just back to you. As long as there is some kind of language, that specifies oversight, I would feel more comfortable.
Any further board comment before we look to the public?
I always leave it to the elders to go first. Okay. First of all, I think it should be really clear that peer support is not necessarily therapy. In fact, it isn't therapy, and it's against the law for them to practice therapy. So if we're thinking, oh, they're going to be doing therapy and hurting people, I think we need to revise that. The other thing is peer support and peer specialists is built into the Mental Health Services Act, as many of you know. It's clear language, and it was meant initially, one of the intents was for people with mental illness to have a career pathway. And what better career pathway through recovery than peer support? So by trying to make this more like, well, these are kind of quasi-licensed people, that was never the intent of the Mental Health Services Act, which all of you know because you're quite familiar with the Mental Health Services Act. So I think it's important also to realize that there already is national certified peer specialist certification, and this is one of the programs that Mental Health America is pushing for certification. Okay, and in this certification program, it includes supervision. Includes a minimum of 3,000 hours of supervised work or volunteer experience providing direct peer support. It also requires one professional letter of recommendation and one supervisory letter of recommendation for certification. And so I think there's supervision built in all the way through there. And of course, at the entry-level positions in the mental health system, there's always supervision. There is always supervision. Now, you might be saying, well, it should be a licensed person or whatever, but it could be a case manager supervisor. It could be an administrator supervisor. It could be a number of people that would be supervising the peer specialist. But the point is they are getting supervision, they're not doing therapy, and this is really intended to implement the provisions of the Mental Health Services Act.
I want to thank Jan Lee. Very well said. I think, you absolutely expand, what I've said. So, yeah, absolutely. Because, even in my agency, the right now, the peer support level, actually supervised by the case manager. And the case manager supervised by, all these different layers. And so it's never meant to be, the clinical service, which is very important to distinguish that two types of services.
Thank you. Good clarification.
Yeah.
Any additional comment? I think we do need a motion on
I
this
would-
one, right, Roseanne?
I would like to make a motion to support, if amended, the position, to adopt the PNA recommendation, and to direct staff to continue to work for those, the two areas, right?
Well, they've indicated they're not going to do the fingerprinting more than
Right.
likely. So
Yeah.
my suggestion would be to support if amended, include the language in paragraph number 3, which is on the top of page 267, and then include a supervision component, including but not limited to our license types.
Yes, that's
Does
my
that
motion.
work?
Yes, that works.
I second that.
And that would include LPCCs and LEPs.
Any additional public comment? Okay, I think we can call for a vote.
Yes.
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 Aye.
Yes.
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 We have a request for a quick break. So it is 2:32. Let's come back if we can right around 2:40. All right. So we are going to move on to, where are we? Senate Bill, thank you. Senate Bill 163. Oh, wait a minute. We don't have our key player, Roseanne. Where's Roseanne?
Everybody's missing. What's the number of the bill again?
163, but we're going to wait for Roseanne
Yeah.
at this point. All right, then I guess we are still on break. I apologize. I thought we were ready to come back.
No, I think we cut them 3 minutes or something.
She's here.
Especially for those of you that had to fly.
No. Georgiana's here. Hi, Roseanne's here. She's here. Okay.
Now we can really start the meeting. Thanks. Okay, so Roseanne, we have SB 163. Portantino.
I think I will call the meeting.
Yes. So 163, that is sponsored by the DIR Floor Time Coalition of California, and it seeks to close some of the loopholes that insurance companies use to deny treatment for behavioral health treatment for pervasive disorder, developmental disorder, or autism. And then it also revises the definition of a qualified autism service professional and a qualified autism service paraprofessional. So under existing law, every health plan that provides hospital, medical, or surgical coverage must also provide coverage for behavior, developmental disorder, or autism. And they need to maintain a network of qualified autism service providers. The law defines behavioral health treatment as professional services and treatment programs, including applied behavior analysis and other evidence-based behavior intervention programs. The law also defines a qualified autism service provider, a qualified autism service professional, and a qualified autism service paraprofessional. And then the highest level, the qualified autism service provider, that person has to be certified by a national entity, and then it also has to be a licensed person. So it can be a psychologist, marriage and family therapist, educational psychologist, clinical social worker, or professional clinical counselor. So it includes all of our license types. This bill would modify the definition of behavioral health treatment to specify that it means professional services and treatment programs based on behavior, developmental, behavior-based, or other evidence-based models, including ABA, or other evidence-based intervention programs. So it kind of expands that a little. It also specifies that the behavior health treatments intervention plan utilize evidence-based practices with demonstrated clinical efficacy. And it makes a change to the definition of a qualified autism service professional. It specifies that they may provide treatment consistent with their experience, training, or education. And then it requires them to meet one of the following criteria. Currently, they have to meet education and experience requirements to be classified as a vendor by a California regional center. That's still one option, but they can also have a Bachelor of Arts or Science degree or be one of our registered associates. So that also becomes an option. They can be an ASW, an AMFT, or an APCC. But if they're one of our license types, they can't supervise a qualified autism service paraprofessional until they have at least 500 hours of experience. And then the law also tightens up the definition of a qualified autism service paraprofessional a little bit too. And let's see, it removes a clause exempting health care plans in the medical program from the requirements to provide behavioral health treatment for PDD or autism. And it specifies that the setting, location, or time of treatment cannot be used as the only reason to deny or reduce coverage for medically necessary services. So some cleanup looking at what the loopholes are and how to close those loopholes. The bill, in terms of the main effect on our board's licensees, is it would qualify our associates to be an autism service professional. Currently, there's a little bit different process to qualify. Last year, the board considered a substantially similar bill, SB 399. The board took a supportive amended position, and at the time, the board asked that LEPs also be included as someone who can be a qualified autism service professional. However, upon discussion with the author's office and the sponsor last year, they argued that change would be counterproductive for LEPs because they are already classified as an autism service provider, which is a higher level of service. So I don't recommend that we ask for that same amendment this year because, as the author's office put it and the sponsor, including LEPs as in a lower category when they're already in a higher category could be counterproductive to them because it could allow insurance companies to require them to be supervised and to be paid at a reduced rate. SB 399 was enrolled but was ultimately vetoed by the governor. He stated that the standards for providers of behavioral health treatment had already been updated in the prior year. At the April 5th, 2019 meeting, the Policy and Advocacy Committee recommended that the board consider taking a support position on the bill.
All right. Leah?
I always have stuff to say, don't I? Hey, but I'm engaged.
You're married.
You're so funny. I think we're getting kitschy here. I really support this. In the past, I know they've tried to look to seek their own licensure, and I think this is a better resolution to the problem. They should be covered as specialists in this area through insurance. So I was really excited to see this instead of another pursuit of licensure.
And just for the record, I was also heavily in support of this bill because I think it does close some of the loopholes that have been barriers for some of our families to be able to access the service that they need. So I am personally very much in support of the bill.
Roseanne, I have a question. So now the license type that include, it's not doesn't have LEP, right? It does. It does. So it's in a higher level.
Yeah.
Okay. So, so what about do we need to make any changes, in response to Okay.
Microphone. Roseanne, microphone.
They're already considered providers, so we don't want to put them in a lower category.
Right.
That was the result of the conversation that I had with the author last year. In terms of the provider, those can be the associates, so the 3 associate types. So there's no associate type for LEP. So I don't think we need to, I don't see any amendments that we need to recommend. If somebody sees something, feel free to say it, but I don't see anything.
Any further board discussion? Public comment?
Rebecca Gonzalez, NASW. We recently came on in support.
Thank you. Okay, back to the board. We have a motion.
I'll make a motion to support and allow the staff to make any non-substantive recommendation changes if necessary.
I'll second that. Did Peter, you want to second? It's fine. I'm just pushing it forward.
Any further discussion? A public discussion? Christina? Christina Wong. For the second.
Yes.
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 Aye.
Yes.
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 Okay, Roseanne, Senate Bill 601.
Yes, this bill is authored by Senator Morell, and the sponsor is the R Street Institute. And the bill proposes allowing the board to reduce or waive fees for a license or registration renewal, renewal or replacement of a physical license if the licensee or registrant can demonstrate that they have been affected or displaced by a state or federal emergency. So currently state law defines 3 different types of state emergencies. There's a state of emergency, which is a proclaimed existence of disaster or extremely perilous conditions to the safety of persons or property in the state. It could be a fire, flood, storm, earthquake, cyber terrorism, and it has to be of such great magnitude that it's beyond the control or personnel or equipment of any single county and city, and it instead requires combined mutual aid. And there's also local emergencies, which has a somewhat similar definition, and then a state of war emergency, which basically means that an attack is imminent. So that's the types of state emergencies. And then at the same time, of course, the law establishes the Board of Behavioral Sciences fees for initial license and registration, and then fees for a replacement certificate, which are usually about $20. The law also, not for this board, but for optometry board, they have a clause in their law that allows them to waive an application fee for an optometrist license if the applicant can establish displacement by a federally declared emergency and they can't relocate back to their state of residence to resume their practice without a economic hardship. So there's that clause in there for them. We don't have a similar type of clause in our law at all. So under this bill, we would be able to reduce or waive a fee if we had that kind of emergency. It would need to be under the provisions of this bill. It would need to be done within 1 year of the proclaimed emergency, and the requester would need to demonstrate being displaced or affected to the satisfaction of the state agency. The author cites the reason for running this bill is due to, of course, the recent numerous wildfires and other disasters. We've had the Tubbs Fire, the Southern California mudslides, and of course, the Camp Fire. They estimate that these disasters affected about 380,000 businesses, and a lot of those businesses contained licensees. And so these individuals already have hardship, and they're being asked to pay replacement fees or to renew their license. And they want to help relieve the pressures on these individuals to get them back to work. In terms of how it would affect this board, it's difficult to predict the potential fiscal impact to the board on lost fee revenue for any given emergency. In most cases, like in the case of the Camp Fire, there were some licensees who were displaced. It wasn't a large volume. Of course, there's always the possibility that if there was a major disaster in an area with a high concentration of licensees, that there could be a significant fiscal impact. If the bill were to pass, the board may need to consider regulations to figure out how to process a fee request or process a fee waiver, what types of information would be considered proof of being displaced or affected, or the board could leave this on a case-by-case basis. I will note that Senate Business and Professions Committee asked for more specifics in their analysis of this bill for committee hearing. They asked that, what is acceptable proof be a little bit more specific, so that the boards didn't all have to run regulations to specify that, and that we could get something that's a little bit more uniform. At its April meeting, the Policy and Advocacy Committee recommended the board consider taking a support position on the bill.
Christine?
So,
Oops, sorry. Then Max.
So, Kim, during the Policy and Advocacy Committee meeting, didn't you say that this had come up actually for us after the Camp Fire, and you had some examples of how
Yes.
you handled it?
So what we did is there was there was a map of the fire that showed the addresses of the streets where the individuals lost their homes. And so essentially, we had some licensees, associates, and full licensees request a replacement license. I waived the fee. Yeah, so it wasn't really hard to prove, honestly.
And I think that you had said at that time it really wasn't that big of a deal.
It was not. I would say we had less than 50 requests, and at $20 a pop for a replacement license, I don't need the $20 that badly. They have bigger issues besides that.
right.
Yeah.
I think I'm just going to go on record. I think we should support the bill.
I want to,
Max,
Max and then me.
Christina.
So to me, it's just a clarification because I'm also in support. I see the benefit of it. Obviously, this is a general bill that affects all licensing in California of any kind. So it's not like really our place to try to find something that fits the board properly. But it definitely, when it goes back to us in terms, if it passes as a bill and we had to articulate how it's applicable for us, just because an emergency, there are emergencies that last a week, a month, how you define that. I mean, I know it's the state or the federal government calling for an emergency, but then there is a lot of time frame because in our case, the license goes through a process, not just a one time, like a broker license for a real estate. You renew it once. It's, once every 3 or 4 years, I don't remember, but you do it by its one phase of the application. For us, there is a different steps. So this could waive different other, which I agree with. So I think it's going to be definitely something that we need to look into if it passes or how it's going to become applicable for our licensees because there is so many gray areas in there. And I'm not concerned about people taking advantage. It's more like being fair process, so how people are able to apply to it. So it's very interesting, but there are even riots in, there is even a, so that would be, hopefully are not our licensees going a riot, but.
I was just gonna, are you done, Max? I'm sorry.
Yes, I'm done.
So I guess my question would be, does this also include someone who actually just experiences a personal emergency, their house or business burns down?
No,
So that would not
Yeah, it has
include
to be declared an national or state emergency.
Christina, sorry.
So I really want to thank, Kim and the board staff, really help the campfire victim, in that process, when they experienced the disaster and they really wanted to be in compliance with the law, because they said that when you practice, when you practice therapy, you have to have your license. So they're very concerned that I need to have my replacement license. And Kim, and the staff really work hard, to try to, get their needs met and waive their fee. And so I think, that's, in the middle of all these disasters, it's one little thing that I think, the board can support, these mental health professionals, to be able to, to just knowing that, okay, that's not one more thing that I have to pay.
Right.
And so, so it's, for especially living in the campfire area, it's a big support and relief for them. And so I strongly recommend that, the board provide their support to this bill.
Alex.
Yeah, with regard, I fully support this too as well. I volunteer for the American Red Cross, and I know that it would be great to let the author know if they haven't been working with them. They have a great database of folks, they collect. Sometimes they have the victims have to avail themselves, but that's something to coordinate. They'll have a list of folks, they may have licenses, and to really cross-check. And that way it will provide a service for us as a board to working with a nonprofit. So.
Any additional board comment? Public comment? Okay, do we have a motion then?
Okay.
I would like to, go ahead. Go ahead. That's
Okay,
fine.
I move to support this bill.
I'll second that.
Okay. Any additional comment before we move to the vote?
Do we need to add make any direct staff to make any no? Okay.
No, we're getting a no.
Okay.
All righty, so we're going to start over here. Dr. Brew,
Yes.
Christina Wong,
Yes.
Jonathan Maddox,
Yes.
Dr. Peter Chu,
Aye.
Betty Conley,
Yes.
Max Disposti,
Yes.
Dr. Christine Whitlisbach,
Yes.
Alex Kim,
Yes.
Gabriel Lamb.
Yes.
Motion passes.
All right. And the last item in this agenda, Senate Bill 660.
Okay, SB 660 is authored by Senator Pan, and the sponsor is the California Faculty Association. And the bill would require California community colleges and the colleges in the CSU system to hire one full-time equivalent mental health counselor per 1,500 students enrolled at each of their campuses. The bill specifies that this requirement is a minimum requirement and that additional mental health providers can be hired based on the campus's additional needs if they so choose. It provides a definition of a mental health counselor as someone who performs specified mental health services and is licensed in California by the applicable licensing entity. It requires educational institutions subject to the requirement to do some data collection. They would need to report every 3 years on how their funding was spent, and they need to report results from a campus survey and focus groups about student needs and challenges regarding their mental health, emotional well-being, and sense of belonging and academic success. And it also requires reporting of campus data on attempted suicides. The author's office notes that the International Association of Counseling Services recommends one full-time equivalent mental health counselor for every 1,000 to 1,500 students. The UC system reports that they meet this ratio. However, it's estimated to be significantly higher for the CSU system, But there's not a lot of reporting and data, so it's really difficult to know if the if the ratio is being met or not. So the author's office believes this will help address the mental health crisis facing California's public higher education system. At the last meeting, staff raised a couple of questions about the board may wish to consider. One of those questions was, would it be preferable to specifically state which licensing boards are considered applicable licensing entities? Right now, they just say that the professionals have to be licensed by the applicable licensing entity. It doesn't define what that is. And then the second question that was discussed was, should associates and trainees be included in the definition of mental health counselor? Last year, the board took a support if amended position on a very similar bill. The board requested that in addition to licensees, that trainees and registered associates also be permitted to be hired to meet the ratio requirement. With that bill, Governor Brown ultimately vetoed it, saying that the specific ratios should remain within the purview of the boards or with local campuses. So the bill last year was vetoed. At the April meeting, the Policy and Advocacy Committee recommended the board consider taking a support if amended position on this bill. And they recommended that the bill define a mental health counselor. They suggested it would be clear to specify the actual licensing boards or license types that are acceptable. And then the bill specifies that acceptable mental health counselors hold a license, but the committee suggested the board's registrants be considered acceptable to count toward the ratio as well. And so staff did relay these concerns to the author's office. And so when I talked to the author's office a couple of times. They said they would discuss them with the sponsor, and they noted the potential for some concerns, but they would have the discussion. And the last follow-up I had another follow-up with them on April 30th. They stated that they would be happy to clarify the mental health counselor by a license, instead of saying by the applicable licensing entity, to name the licensing entities, and so they're willing to submit those amendments. In terms of the suggestion that registrants be included as well, they said that they have concerns with including registrants. They are concerned that campuses will bring them on as cheap or free labor, and also that supervising would add to the workload of campus licensees. So they are not amenable to that amendment. So that is the follow-up for this bill, and we can have a discussion on that.
No.
Shocking.
Leah.
I work at a university, so I got opinions.
Leah.
Okay, so what's really interesting, and maybe there's nothing we can do about this, but the model across the country in many mental health services clinics on campuses, they have even trainee level people in them. And they're not getting paid anyway, no matter where they go, and half of our associates don't get paid anywhere. So I don't find that problematic, because it increases their chances of being able to get into a university setting when they're ready for licensure or whatever. And it's a wonderful training ground. And a lot of my students, at least, are really interested in working in college counseling settings. They are already working in college counseling settings at the junior college and at universities in California. So that's interesting. Maybe that'll just help improve the ratios. If the CSU website is up to date with our current staff at our counseling and psychological services, our ratio is 2,500 to 1. And we have long waiting lists, and often students on campus get referred out. If it's not something they can't whip up in less than 4 or 5 sessions, they might mediate a crisis issue, but that's all they have time to do. So in that way, I support it. My only hesitation, other than not allowing associates or trainees count, the reason I am hesitant about not letting associates and trainees count is because when laws like this go into place, that doesn't mean we're going to get funding. So that money has to come from something else. It takes away from students in some other way. And my campus is the lowest funded campus in the CSU, probably out of all the, I would imagine there's no UC funded less than us. And the thought of having funding being cut in any other area frightens the heck out of me. So I don't know, if there's any way you can go back to the author and say, look, it's already happening anyway. They're already seeing trainees and associates, and it goes really, really well. They get excellent supervision, so that means they get excellent services. And it's a way to keep that ratio without increasing expenses, because there are already a lot of good licensed people who are qualified to supervise. And then we don't hurt the other students on campus or students in other ways by trying to find funding to do that. Like even when we have salary increases, we don't get that money. We have to go get grants to fund our salary increases. So if I think about doubling the number of our staff and those salaries times 10 or 15 and no funding to support it, then that really feels unfair. So it's a mitigating factor if they would allow at least associates, if not trainees, count toward that ratio.
So I have a question, Roseanne, considering what Leah just said. If this bill passes, if we support the bill and it passes, is that then going to eliminate the option of the registrants?
No, what they said in their response does not limit the number of paid or unpaid associates CSUs decide to have. It only sets minimum for licensed, not associates. And they go on to talk about caseload and things like that. So it doesn't preclude them from hiring them. They just don't count toward the ratio.
Which means we got to come up with funding
Yeah.
for
No, I
licensed
get it.
people at 60, 70, 80,000 a pop.
So I guess the board conversation should be oppose unless amended. Is that the tack we want to take? 'Cause that's the strongest position we can take.
That's the strongest position you can take.
On the other hand, do we want to go on record opposing something that we know is incredibly good for students? That's a tough optic.
But it hurts students, right?
Yeah.
It also hurts students if they don't support it financially.
So, a question for you, Leah, because obviously I'm not. But it's also true that when we create, we reflect the need. It's real. We know that if we could, we'll have a ratio that's much lower than that. I mean, higher, proportional to the needed. Having a bill that actually supports that need, and definitely will have to make sure that universities and higher education entities had to. And I know money just doesn't come from the sky, but has to be calculated because it is a vital services, as we all know. So I understand the position you're sharing about money has to come somewhere, but at this point, we need to support a bill that shows the need, the mental health need of that population. I can't take too much in consideration that, not because I would say I don't care, it's not my problem, but it's definitely something that perhaps even the state of California might have to intervene in order to budget into it. They're not doing it right now, I'm aware of that. But it could be a political statement on showing the need, the vital need within the higher education system. So I don't even know if I'm okay with amending it because it seems like we are trying to care for some of the university, also higher education that really don't, they're really profit driven. Not the Cal State, but
No, Cal State's becoming more
yeah. And so at that point, really, we had to focus on the needs of our students in terms of mental health, and the ratio, I think it's really, really proven to be way, necessary. So
So the irony is, the very people who are going to vote on this bill are the very people who are deciding how much money we get. So they'll say, sure, we'll let this through, but we're not going to give you anything for it. I mean, it's just kind of ironic to me.
I'm sure.
Because it's not, the lack of funding is the legislature.
Right.
Because they decide the budget and then the governor signs that. So just, I want it on the record.
Right.
Regardless of where we go or how we vote.
Christine?
I completely understand what you're saying, but I want to echo what Max said and just add to that. This is not about you, but just in response to what you said, when I hear statements like that, like, well, the money's got to come from somewhere, they're going to cut it from something else, and that's going to hurt students. And I don't mean this not negatively against you or what you said. It's like, it's hard for me to take that argument into to give it a lot of weight, because I don't know, and it doesn't sound like because you would say where they're going to cut from. And I think, when you're talking about priorities and what's priorities for our students, mental health is certainly vital. Yes, vital. And so, I think we just have to think about that when we're making this decision. I hope that was clear.
Yes, that was clear. It's, as a department chair running a budget, I have a whole different frame.
Totally get it.
And you
Totally
make
get it.
perfect sense,
Yeah.
but it's painful
Yes,
when
of
these
course.
mandates come across and there's no support.
Sure.
I guess the counterbalance to that is I'm not sure that in any other setting we actually dictate from legislature that licensed staff need to provide, are the only ones who can count toward a particular count for providing services. And when we look at sort of the need on school campuses, at no point have we said that only licensed staff can actually be on school district campuses or contract with school districts to provide mental health services, because we see the benefit of associates and associates providing that work as they develop professionally, as they get sound supervision. So I think in my opinion, they're going to abuse associates is a disingenuous argument, because any sort of healthy behavioral health program is going to have sufficient supervisory oversight so that the associates that are there are getting competent, credible, and consistent supervision so that they can become licensed and then move into that next role. So while I hear both Max and Christine, I'm just concerned that they are not allowing associates to be considered, because they are an awesome resource that sort of supports and sort of fills the need in the mental health pipeline. I just don't understand why we're limiting it to just licensed staff. To me, that doesn't make sense.
Max and then Peter?
Sorry, and maybe I'm wrong, the way I read that was like sometimes we have institutions that overexploit in associates to do extra work on every aspect of it. Sometimes, most of the times, they're even not getting paid. It's kind of like to protect both. That's how I read the bill. It's like you got to have a licensed person to do this work on that ratio, and then you can have as many associates as you please but you need to rely on a licensed. That's how I read the bill, more that not allowing university to, for lack of a better word, exploit the opportunity to involve more students, but the opposite is like not to rely too much on them because of budget restriction. But then in a situation like that, I can see now over-exploiting the work of associates that they have. Obviously, they're still training and everything else to comply with the ratio. So it's risky in both ways. So, but I was reading the bill in the opposite direction. It was actually to protect the...
Unless you put a ratio of 80% have to be licensees.
Well, but then you have to, based on what numbers, how you come out with that.
Peter?
I don't know.
Were you done, Max?
See.
See?
Thank you. I just want to echo, what Christine is saying. I think the author is a pediatrician. I think it's more like a priority statement. I know so many top universities, you have no idea how many people drop out and have depression problems. So what is more important? I remember my college visit days, the first thing I asked, what kind of counseling service you have? Not that my kids have problems. But anyway, so I really think, we should support this bill. And I understand where you're coming from, but I think you got boxed into this thinking as an administrator. what is more important? What's most important in a young person's life going to college?
Roseanne, clarification. So right now we have two choices: support flat out, which I'm hearing from several people. What is the weight of support if we leave it as is, support if amended? Does that significantly diminish the weight of the support?
It means if they didn't want to amend it, then they wouldn't have our support.
So we wouldn't go on record as having supported?
No, not if it wasn't amended. So if they didn't make
And
the
it doesn't
amendment,
sound like they're willing to make that
it
amendment.
does not sound like they're willing. They were pretty firm in their response.
So then I guess the question really is, I think we might as well open it up to public comment and then come back for a motion. Oh, we have more board comment? I'm sorry.
I was just more thinking, reading, the history of the bill again, so it looks like it's put on suspense file. And so
it has a pretty big fiscal on it.
Yeah, it does. So, does it mean that, it's gonna,
It doesn't
get all of
mean
it,
anything
or-
at this point. What happens is pretty much any bill with a fiscal over a certain amount gets put on suspense, and I believe it's next Wednesday, they will announce which ones move basically which ones die and which ones move forward. So no telling, it could be dead by next week or it could be moving. We just don't know. They have to go through look at all the fiscals and figure out where they want to spend the money.
Thank you.
Public comment.
Kathy Atkins with CAMPT. Like the BBS, CAMPT struggled with wanting to support a bill that provides additional mental health resources and funding to California students. But we also struggled with the lack of definition of mental health counselor, primarily and secondarily concerns about unintended consequences to associates or trainees with current positions or future positions. At this time, we're awaiting any analysis that might come from following the suspense file appropriations committee, and then once that comes out, assuming it moves forward, we will be re-engaging with the sponsors. They are aware of our concerns. We've had similar conversations as Roseanne has indicated, but again, we'll re-engage once we see what happens following their current committee status.
Rebecca Gonzalez, National Association of Social Workers. We actually support the bill as is. Currently, we have many mental health associates, trainees, and social work interns that are providing these services on campuses, and I think that will continue. By only having licensed professionals in the ratio, it will increase supervision for these other folks that are providing these services. I think it's important to make a strong statement that we want to support the provision of professional services on campuses, and that only those professionals should be included in the ratio.
Thank you.
Janley Wong, NASW. I'm glad that Roseanne pointed out that this still has to get out of appropriations. And I think that should address the concern that there's no money for this. Because if the Appropriations Committee, which is looking at the entire state budget, all the departments, all the programs, if they think there's not enough money for this and they can't get it from any other place, it won't come out of appropriations.
So that probably is a stronger even argument for why we would want to make sure that we come in support of it.
Right.
So I'm looking right at Christine.
Okay, great. I move that we support this bill.
I'll second.
Okay.
I'll second.
We need to go for thirds, right?
Right.
Any additional comment? Any additional public comment? Let's call for a vote.
Yes.
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 Aye.
No.
Yes.
Yes.
All right, so we are skipping our next agenda item, which is, so we're moving on to item 20, which is Senate Bill 425. Roseanne?
So Senate Bill 425 is authored by Senator Hill, and he is also the sponsor. The bill requires health facilities, clinics, or other entities that make arrangements for a healing arts licensee to practice or provide care to patients to report allegations of sexual abuse or sexual misconduct by a licensee to the applicable state licensing board within 15 days. And the reporting requirements also extend to employees of these entities or organizations. So under current law, boards under DCA, including this board, are required to create and maintain a central file for each license holder. It has to contain information regarding any of the following, if it's applicable, if they have convictions of crimes in the state or another state, any judgments or settlements requiring a damage payment over a specified amount for negligence or injury, complaints by the public, or any discipline information required to be reported to by a peer review body or a licensed health facility. The contents of the file are required to be confidential. Any insurer providing professional liability insurance to one of our licensees has to report any settlement or arbitration award for death or personal injury by negligence, error, or omission that's over a specified amount to the board within 30 days. And a court within 10 days of a judgment that a board licensee committed a crime or is liable for a death or an injury, or a judgment over $30,000 has to be reported to the board by that court. And then finally, the chief or director of a peer review body or licensed health facility clinic has to report within 15 days to the board if a licensee's staff membership or privileges have been denied or rejected or terminated, or any other restrictions on staff privileges or employment that have been imposed for 30 days or more in a 12-month period for medical disciplinary reasons. So there are certain reporting requirements already in place. The chief or director of a peer review body or a healthcare facility has to also file a report with the licensing body within 15 days after a final decision or recommendation of disciplinary action following a formal investigation, if it determines any of the following may have occurred. Incompetence or gross or repeated deviation from standard in care involving death or injury that's injurious to the a person or the public, using or prescribing controlled substances in a dangerous manner, repeated acts of excessive prescribing, and then the last one is sexual misconduct with one or more patients during treatment or examination. But note that that only has to be reported after a final decision following a formal investigation. So that's kind of the key words there. The peer review body does not need to make a report based on this if it does not make a final decision regarding a disciplinary action. So this bill would require any health facility, clinic, or an entity where one of our licensees is working to report any allegation of sexual abuse or misconduct to the licensing board within 15 days. This even includes if they have full staff privileges or if it's a limited agreement or courtesy staff privileges, anything like that, any kind of contract or other thing. And then the same thing applies to the employees of that entity. They have to report it as well. A willful failure to report would be punishable by a fine of up to $100,000 per violation. Any failure, so a non-willful failure, is punishable by a fine of up to $50,000 per violation. A person or entity that makes a report shall not incur a civil or criminal liability as a result of the report as long as it's made in good faith. And the applicable licensing board must, upon receiving one of these complaints, must investigate the underlying circumstances of the report. And then the bill also, you're going to see some other stuff that's unrelated to us. It makes some changes to the medical board's licensing laws that are related to its enforcement process. So part of this bill affects us, part of it just affects medical board. So with the part of the bill that affects us, the author's office is seeking to close legal loopholes that can allow a practitioner with repeated sexual abuse and misconduct complaints to keep practicing at a health facility for many years without the licensing board being notified. This is in response to a May 2018 report by the LA Times, where it was discovered that multiple unresolved complaints by a USC gynecologist who had worked at the university for almost 30 years had been made, and none of them had been reported to the medical board. So in response to this report, the author of this bill, Senator Jerry Hill, convened a hearing on sexual misconduct in the medical profession and found that there are different types of reporting standards for different types of health facilities. Some facilities have no requirement to report sexual misconduct or abuse. Some have the peer review bodies, and then the rules for them reporting up that I talked about earlier apply. In attachment A is a really interesting discussion paper. It's part of the meeting or the materials for Senator Hill's hearing, and it talks about the different types of peer review and what some of the challenges of that are. It doesn't necessarily guarantee a report will be made because there has to be a formal review and a final finding, and sometimes that doesn't happen. Only if a final decision has been made. Staff asked the author to clarify, because the bill talks about other entities that arrange for a board licensee to practice or provide care. I asked them if that's meant to include all board licensees in all settings, because they kind of defined other entities as including like a school setting, and it was just kind of a little bit strange. But they indicated that yes, their intent is to ensure that all instances of complaints and sexual misconduct be reported in any setting at any time. So that is the correct interpretation of the bill, of what they're trying to do. The board may wish to discuss whether the reference to other entities in Business and Professions Code Section 805.8A, 3, B, and C makes it sufficiently clear which settings and individuals must file a report, especially given the steep fines associated with it. In terms of the fiscal impact on board operations, it's really difficult to know because it does significantly change the reporting requirements for sexual misconduct. So basically anyone, whether an employer or an employee, if they heard anything about it, would have to report it. However, it's unlikely it would lead to a significant fiscal, because complaints for third parties are more likely to close than other types of complaints that are more direct. Typically, in the third-party complaint, if the victim does not wish to participate, then if they don't participate, there's often a lack of evidence, and the case closes because there's no evidence. So staff believes that the increased caseload would be minimal and could probably be absorbed within existing resources. At its April meeting, the Policy and Advocacy Committee decided not to recommend a position on this bill, but opted to continue to watch to see if there are any new developments between now and then. There haven't really been any new developments. There's been some minor amendments to the bill, but it's still substantially the same. It is scheduled for hearing in Senate Appropriations next week, but the bill is very similar to what we saw at the April 5th meeting.
Christine, well, we have Christine, then Leah, then Peter. And Max.
Everyone
Christine,
has something
Leah,
to say.
Peter, and Max. Okay.
So I think we can probably all say that we're sympathetic to the intent of the bill. Clearly, what happened at, or was it USC? USC should never happen. My issue with this bill is that there's reporting when there's any allegation, regardless of whether that allegation has been substantiated. So that's one side. The other side of the bill is, well, if they can't substantiate the allegation, then it'll go nowhere and the practitioner's okay. But I don't know. I just think it's a slippery slope, and it's hard for me to support something like that.
Leah.
Yeah, so I was curious why the P&A committee came to their conclusion, and that's one of my questions, and also why the CMA, California Medical Association, would negate it, because it's not just USC, it's Larry Nassar, and it's all over everywhere. So, yeah, I can see the complications. And it's one thing if there's a single report, but if there's 5 reports or 10 reports, then, if it smells like if it quacks like a duck and it walks like a duck. Anyway, so P&A, yeah.
So can I make a reply? Jump the line. Yes, I am jumping the line, but I'm replying to her. So, and I think what we anticipated at that point at P&A was that the bill might have some significant changes because there's so much discussion going on and so much response. And so, to be very honest, I was very surprised that it actually not much has changed and it's flying through the process. And so this is really the reason. We were just thinking about we have the similar concern. How the board could afford doing all these things, and how the the investigation is going to go, all different types. We touch on it, but since now it is pretty much the same. So I think we're coming back to the full board, to really make a decision. So I'm in the same position with Christine, because I think I really support the spirit of the bill, the intent of the bill. And yet, when it's come to the implementation, that's always about, that's really where the devils are. And the hefty, penalty for not reporting, that's just a little too much. So, Roseanne.
I will say that regarding the fine amounts, because I thought that was a little weird too, I read the Senate BMP analysis, and they did state that the fines are in line with the current fines for failing to do 805 reports and things like that.
Oh.
So
it's
so
not
there is
out of line.
precedent for it.
Yeah.
Peter.
Yeah.
Thank you. I might have missed what you've said, how they define allegations in the bill, in the proposed bill, or is it different than complaints?
How do they define allegations? It says, let's see. Within 15 days of receiving an allegation of sexual abuse or sexual misconduct. It doesn't really define an allegation of sexual abuse or sexual misconduct. You learn of an allegation, you're required to report it.
I think it's very vague. Allegation made by a patient to the hospital, to the facility. So
I will say that when I read the Senate BMP analysis, that somebody had brought up the question, to the committee of, what about a rumor? And the statement was that it's not the intent of the author's office that a rumor be reported, but there's not a definition in the bill.
I tend to not support the bill, or just leave it for now. Not doing anything for now. I think it's flawed.
Max?
Yeah, I share the sentiment. I feel that it's almost like a knee-jerk reaction about a very serious problem, because I remember the article in LA Times. It was just unbearable even to read, or the level of abuse. But then also the 15 days, I just don't know how they came out with now a protocol that's so really tight, and not because I'm thinking about in running an agency that even though it's fairly small, and so also there is an internal investigations that you do in order to make sure you address things properly, because now you have a licensee that's been accused of, let's say, from a patient that's might be true or not, we don't know, matter there is and definitely now you're putting what happened to the licensee in the meantime. You suspend the license, you don't operate, you fire them. There's a lot of complicated. It seems to be very simplistic to me, the bill, in the way it's presented, and obviously there is this need, but I don't know if this is really responding. Actually, might not do us a favor when it comes to supporting the victim of sexual assault in this case, and putting in place a process that's actually not clear. I don't know. So I share the sentiment of stay neutral at the moment and see what happens. So we don't do anything.
I think we're going to look for public comment at this point. Okay. Do we need to check the pulse of the board. We had, I think, Christine, you were in support of. You're okay with neutral? Okay. So it sounds like at this point, we're going to stay neutral on it until we get some more details. But maybe Roseanne, if, I don't know if this is even appropriate, but to give them the feedback that our concern is somewhat the lack of specificity and the kind of nebulous allegation. Maybe you can just convey the conversation.
Lack of specificity regarding the definition of sexual abuse or sexual assault.
Yeah, and how allegation can be problematic, especially with the populations, frankly, the populations that we deal with. I think there's complaints and then there's allegations, and there's a difference between a complaint and an allegation.
And we couldn't move forward on simply just, we would just get the report and we'd have to wait for the outcome. I don't know, just because I know about it, I still can't put it up on the website. So that exactly, it means that I could have 10 reports about a particular individual, but if I do not have clear and convincing evidence to move forward with formal discipline, that's all it is. It's just 10 reports. That's it.
And then the potential for harm for that professional if those things actually are not true is,
Well, exactly. And the problem is I can't even release that information to the public because it's not vetted out through the due process.
Christine, and then Christina.
I think that's a really important point that I actually honestly hadn't considered beyond what my concerns were originally. I think the intent is, well, we're going to take this out of the organization's hands, and if there's multiple complaints, surely the boards will do something, but you just said that we couldn't anyway, even if there were 20 complaints.
We would have to investigate, and a lot of times in those types of investigations, we wait until the entity finishes their investigation. And if they find something, that's great. That's what the 800 and 805 reports are. We may get an allegation that something's happening, but we're not going to get any patient information most likely. And if we did, we'd have to reach out to that individual that was harmed and see if they would want to participate in our investigation. It's just, it's going to be a challenge.
It doesn't really solve the problem.
It doesn't really solve the problem, honestly. And I think my own personal opinion about some of the, the Larry Nassar and the USC, I mean, people were covering up their own.
Yes.
And I think that that report coming to us wouldn't have helped any of those victims.
I think that's a great feedback to give to the author's office.
Did we have one more comment over here, Christina?
And I actually was about to make a similar comment about, the original the original problem really come from, for those board who has the peer review process, and then they use that, to hide, some of those, some of those misconduct. And so, especially for our board, it doesn't really pertain to us per se because we don't have that mechanism, to really help, hide, and we have a pretty, straightforward, process, to investigate, and to go on with the enforcement. So I'm just really thinking that, it's kind of like it applied to us, but it's also not quite applied to us. Right. So, I'm okay with a support position.
I understand the intent.
The neutral position.
The intent is great. I mean, I think the concept, but it's just, this doesn't do what I think they want it to do.
And I guess I would add the added point that it doesn't actually hold the institutions where the abuses occurred accountable, like the Penn States, the Michigan States, the USCs, who should actually investigate it, come to some conclusion, and then if the practitioner is found guilty, then it's forwarded to us, and then we can move forward with an appropriate process. It sounds like Max was saying, it sounds like, this is a sly attempt to pass the buck on to us when they're offending institutions are not taking responsibility to protect the victims, and that's kind of unpalatable.
Yeah, I think we're better off just waiting and watching, and taking
So
a,
moving on.
moving it on.
So
Yeah.
you want me to
moving
relay
on.
those concerns?
I think
discussed,
relay
and
those
then-
concerns, support the concept of the bill to protect consumers, but not perhaps in its current state.
I don't know that I'd be able to say that we support the concept. I think we could just say, I could reach out to the staffer and say we didn't take a position on it. It remains neutral, but here are some of the things that came up in our discussion of the bill and possible concerns.
Well, that's probably
so
a better
they
way
are
to
at
put
least
it.
aware of
Yeah,
what they
sorry.
are. If that works.
Okay.
Okay.
So we're doing nothing.
No position, just nothing.
Although I don't think we took a vote on our neutral.
No, we're not.
We went no position on that
position.
either. Okay, all right. We're using the wrong terminology. Thank you for correcting us, Christina. So we're moving on to Assembly Bill 8. Well, I guess he's leaving early.
Okay, so Assembly Bill 8 is authored by Assemblymember Chu, and its sponsor is the Mental Health America of California agency. And this bill is similar to one we just discussed, except for it applies to schools instead of universities or colleges. The bill would require schools to employ at least one mental health professional for every 400 pupils. And that would need to be done by December 31st, 2022. Schools with less than 400 pupils must do at least one of the following. They need to have at least one mental health professional generally accessible to pupils on campus during school hours, or employ one mental health professional to provide services at multiple schools, or enter into an agreement with a county or community organization for at least one mental health professional to provide services at the school. The bill outlines the role of the mental health professional in the school, which includes providing individual and small group counseling. The mental health professional, if they don't have a services credential with a specialization in either pupil personnel services or in health for a school nurse, they would need to be under the supervision of an individual with a services credential specialization in pupil personnel services or administrative services in order to work with pupils. It defines a mental health professional as an individual who holds a service credential with a specialization in pupil personnel services, or a credential as a school nurse, or a professional licensed in California to provide mental health services, including but not limited to psychologists, marriage and family therapists, and clinical counselors. Or it also includes a marriage and family therapist intern or trainee, or a clinical counselor intern or trainee. Author notes that their intent is that schools provide the ideal place to reach all students, especially those who face barriers to access. And the author also notes he will be requesting funds through the budget process so schools can implement the bill. The bill requires a mental health professional working in a school who does not hold a services credential to be supervised with an individual who does so. However, looking at the law, that appears to already be a requirement in regulations. Betty, am I correct? Okay, so there's no concern there. One group opposing the bill is the California Teachers Association. They believe that the only individuals holding a pupil personnel services credential should count toward the ratio. They note that these personnel are trained specifically to deal with children as opposed to other mental health licensees trained to work in clinical but not school settings. A couple of minor cleanup things with this bill. The bill does not include licensed clinical social workers. I know that, or associate clinical social workers or social work interns in the definition of mental health professionals. They're not necessarily cut out of the bill because it uses the words includes, but it doesn't limit it to anybody else. So they could still probably pass it, but it doesn't say it specifically, and it really should. And then it also refers to marriage and family therapists and professional clinical counselor interns, when that really should be changed to associate. So I will open that up for discussion.
Discussion.
So it seems to me that the PPS credential argument is likely because they don't understand what mental health services could be available to their students to help improve their learning. So that would be my assumption, and I would lean towards supporting this.
Yeah, I agree. I think the teachers, well, although it speaks to our very extensive earlier conversation about who is supervising, because again, I think what the teachers are responding to is that disconnect that we've talked about extensively between clinical people and school services. So I would support the bill. I would encourage us to support the bill. I think at the end of the day, it still addresses the mental health needs of kiddos, even though there may be some minor adjustments that need to be made. Peter?
Yeah, I have a question for Roxanne. So requiring the number of professionals is one thing. Does the bill address what kind of services that professionals are supposed to provide?
Yeah, they say provides individual and small group counseling. So it doesn't go into, let me see if it goes into any more detail or if I just summarized it. On page 392, it talks about the role of a mental health professional, including but limited to, and it's providing individual and small group counseling, facilitating collaboration and coordination between school and community providers, promoting school climate and culture, professional development to staff in diverse areas like behavior management and mental health training, trauma-informed practices. So it does go into that a little bit.
Good enough for me, so I would support the bill because, once again, it's a priority statement. We keep saying that mental health is important, and here's an author come up with a bill like that. We should support it.
Christina?
So I support the bill. Used to work as a school social worker. I know how much, is needed in a school setting. And yet, I'm thinking, I'm just looking at the definition of the mental health professional. If we include nurses and the people who have the PBSE credential, that also broaden, how we define mental health professional. And so I'm wondering, if we should actually, I'm thinking about the carved out, that statement, that nicely, define clinical services and talking about the exclusion of the clinical services, whether it would be appropriate to insert that. Just to kind of, to carve out that, those people who practice, those whatever, are not touching, the mental health, the clinical mental health services. That when we
Are you talking about the ERMS?
yeah, the
definition?
ERMS, no, the peer support statement. So there's that, when we were talking about peer support, there's that little statement talking about the peer support, staff should not be doing that. Let me find out. I just want to make sure that, if they define mental health professional, and then also, that in the bill, have a description, that I want to make sure that clarification about,
So you want to make sure that school nurses and PPS credentials are not included in the language.
No, well, that's one thing.
Yeah, I
Because
think a
then it
PPS
makes
credential.
them mental health providers,
Yeah.
and that's not what we want because
No.
essentially they're not.
Well,
With the PBSC,
counseling, school counselors have a
Can't
PPS credential.
right.
So I think the issue, because I looked at the nurse too and went, why is that included? And it may be that they're going with, if you look at the broader description of what they're asking them to do, school nurses do in fact provide health-related counseling, which is very different than mental health-related counseling. But they do that. Gabriel?
Do we need to clearly define counseling versus psychotherapy?
I don't think the bill, I'll look to Roseanne, I don't think the bill was intending to be necessarily the kind of ERMS mental health. I think it was just generic counselors.
I think it's kind of trying to capture a group that is perceived as already doing it, is my understanding. So I don't know that we would want to carve out in this case because it could do more harm than good or raise more questions. That's kind of my feel, is that these are kind of the entities that can provide the type of services that the author wants to provide, and we're going to say you need to have at least X number of them for every 400 students. I don't know that we want to get into having this bill define who can and can't do these duties, because it seems like the education code, from what I've learned from this meeting, is that it's got a very complex set of definitions that are already sort of in place, and just certain people can supervise. There's credentials for certain things, and then you can.
And this is a completely separate issue than ERMS.
Right. Yeah.
This is just talking about counseling. Right. This is talking about, it could be groups of kids in third grade who don't have friends on the playground. I mean, it could be anything. And mostly that's school counselors that are doing that. That's not licensed people. I mean, that's coming under the ERMS umbrella, which is a different kind of a service.
So if I read it in a different way, then, so I think that's that ambiguity that may need to be, to clarify, because, once it started to say like mental health professional, and then it has its own definition, including nurse, and, only with those, with PPSC, and that to me is, I totally understand, where the level of the services, and yet, the language doesn't really reflect. I think that the language itself, when I read it, it just means broader than that. It started to really stepping into our licensing, population, and the services that we will be providing, just on the services. Because when you read mental health professional, that's normally what we meant.
And I know I know the intent was to include school counselors.
Absolutely.
I think the red herring in the pot is whether nurses are kind of a slightly different. They do provide an absolutely critical counseling service, but it's a very different, it's not, I don't know that I would consider it to be mental health counseling service. It's a very different kind of a thing.
Is it possible to make a motion of support with a recommendation without having to, without any amendment, but with a recommendation that perhaps even Roseanne could translate to whoever submitted the bill?
Well, my one comment would be that when we look at the bill, when you look at the definitions, it's for the purposes of that particular chapter only. It doesn't bleed over into anything else. And then when you look at what the role of the mental health professional is within that chapter, they specify 4 areas where they can perform that service. Frankly, I'm comfortable the way it's written. I don't think it's bleeding over into our licensing act or anybody else's licensing act. It's just this narrow carve out for schools to get that ratio where it needs to be. So I don't have any concerns.
Any additional
I agree
comment?
with Kim. I think it's going to cause more. I think that's trying to accomplish a very specific thing, and I think, if you don't want to take a position on it, I think that would be more appropriate rather than trying to sort of poke at it and change the intent.
I'd like to see us take a position on it. I think it's a good thing, and I think, we've had consistent conversations about this is an important need. We need to support it.
I'll make a motion to support the bill. Oh, yeah, but we open. So in the meantime, I can put a motion on the floor as there is public comment.
Public comment.
Rebecca Gonzalez, National Association of Social Workers, California chapter. We are in general supportive of the intent of what this bill is trying to do. And then getting back to why CTA is, why they've taken the stance that they have, that it has to be credentialed people. I think part of their concern as a union, they're always worried about contracting out. And the people on the, schools are the ones that have that credential. So that might help you understand why they have that opposed position. Of course, Roseanne, I agree with you that they need to include us. And I've actually been involved in some of the background talks, and I know that's one of the amendments that they do intend on doing. But our other concern is that in the definition of mental health professionals, we think there should be a separate category that includes all the students, which include social work interns and trainees for MFTs and LPCCs, because we find it problematic to define them as mental health professionals when they're still students. So we don't, I think we're okay with having them in the ratio, but we do think it should be defined separately.
Any additional public comment?
This is Kathy Atkins with CAMP. We're in support of the AB 8.
So we're back to the board. We have a motion. We don't have a second as yet. Peter got one in. All right. Any additional board comment?
Actually, for the maker of the motion, should we amend the motion to include a suggestion, just,
Of the separate definition?
yeah.
I think
Only if you want.
we'd have to have a board conversation about whether.
Doesn't that go, I wouldn't have any problem, but that might go back as a recommendation or as amendment. So we
Support as
decided that
amendment.
we wanted to support the bill, but
Right.
it depends how we put that, if it's just narrow.
Right. If they don't amend it, then we're not in support. So would you support it if they didn't amend it to have that separate definition? The definition of mental health professional, it's just going to be for purposes of that ratio, right, Sabina?
So we are able to add that.
So would we still support it even if they didn't make that amendment?
Okay.
Would we be okay with that?
I'm okay to include that in the motion as well.
Okay.
Well, if we include it, I think we're getting back to that question. If they don't agree to include that amendment,
We have
then
no
we
position.
don't have a position on it. And I don't know that we,
Oh,
I kind of got the sense
Yeah.
from the board
Oh,
that
then
you.
no.
Couldn't,
Okay, no,
couldn't
no.
we just make a motion to support and have Roseanne just make that recommendation
and
to
that's what
irrelevant?
like we did prior to some other bills. So
Yeah.
I,
A
so the
friendly, what's
motion
that called?
stands.
Roseanne, there's a term for it, a friendly.
Friendly amendment.
So you want to, just a conversation that they consider a separate definition like NASW California is suggesting for the trainees
Yeah.
and associates.
Right, that they consider that, but I'd hate to, as we felt about the others, I'd hate to not go on record as supporting this. It's such a universally
Right.
recognized need.
I guess what we're asking is, I would rather like to have clean motion, just like what you have made, and then Roxanne can tell them, on the side. Yeah, I think it would be better that way.
It would be a support, and then I'd have a conversation with them on
Right,
the
yeah,
side
it's
about
just
the
a
separate
side
definitions.
conversation with them.
And that's how the motion was made at first, as
Right,
a
exactly.
stands
I
the
just wanted to
motion.
make sure.
So it was made and seconded. Any additional public comment before we call for a vote? All right, Christina.
Yes.
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 Aye.
Yes. Yes.
Okay. AB 544, Roseanne.
Yes, AB 544 is by Assemblymember Bro. It's author-sponsored. It would prohibit boards under DCA from requiring payment of accrued and unpaid renewal fees as a condition of reinstating a license, or expired license or registration. And it would also limit the maximum renewal fee for an inactive license to no more than 50% of the renewal fee for an active license. So currently our law, we already have that limit for inactive licensees. An inactive license fee is half of the standard renewal fee, so we're already doing that there. The other part of the bill, we do charge accrued renewal fees. Our law specifies processes by which we may renew an expired license within 3 years of its expiration date. So we do that piece of the bill that would be prohibited. The author's office states that for somebody that's maybe out because of raising children or an illness, it does not seem fair to require them to pay several years of accrued renewal fees to reinstate their license and start working again. Like I said, the board does currently charge accrued unpaid renewal fees in order to renew any license that's within 3 years of expiration. Licensees that have been expired more than 3 years have to reapply for licensure. So after 3 years, it becomes a moot point anyways. We don't charge accrued unpaid renewal fees to renew a registration. It's just licenses. We looked back at some data for each of the past 4 years. We don't see a lot of the people coming in with accrued renewal fees. It's fewer than 50 cases per year for the license types combined. So if the bill were to go through, there's not going to be a huge fiscal impact to the board of this. I've recommended there's a couple of spots in the bill. They missed one that's in 4989.68 for LEPs that talks about accrued renewal fees. So I've talked to them about including that. There's another amendment for LPCC law that it strikes a section, but it doesn't talk about, it needs to talk about that we can still charge the renewal fee. So I've talked to them about that. So it's kind of like minor cleanup. I have reached out to them. They have indicated that the bill is on Assembly Appropriations suspense right now, but they are going to be working on amendments once it gets off suspense, and they do have our amendments requested. I have requested the amendments. So with that, I will open it up for discussion.
So are we looking to take a position on this?
I don't think so. It's kind of like the board needs to know about it, but
Okay, so it was kind of informational?
Yeah, I'm kind of working with them. It's kind of informational.
Okay. Can we just move forward, or does anyone want to have any more conversation about it?
Move forward.
Any public comment before we move forward? No. Okay, we are going to skip item 23 and move on to item 24, which is an update on board-sponsored legislation, Roseanne.
Okay, we're pursuing 3 legislative proposals this year. SB 679 is our license portability bill. I'm happy to report that bill has now passed the Senate and has moved on to the Assembly. So it's doing really well. Hopefully it continues to do so, and we look forward to seeing that move this summer. Our other bill, AB 630 by Assemblymember Lowe, our required notice to consumers bill that one's passed the Assembly and is now in the Senate. So that one's moving about the same rate. SB 786, our omnibus bill, the board requested 8 items be included in this bill, and they're kind of adding the items. They're adding a few of our items at a time. So I know another round of amendments is coming in. They're supposed to add the last of the 8 that we requested. However, they did reject one amendment as being too substantive. That was the pending complaints or investigations and examinations. Basically, it would have added. Right now, it would have added a petition to revoke probation as a reason that the board could deny exam admission or refuse to issue a license. Currently, the board can do this when an applicant has a pending complaint or is under investigation. So we would have, under the proposal, been able to do it if there was a petition to revoke probation. They determined that was a little bit substantive. So the board can, if the board would like to move forward with that proposal, we could do that next year, either through another bill or possibly through our sunset bill if there's strong feelings about needing to do that. But that was the only provision that was rejected so far. I mean, they've indicated it sounds like all the other ones are going in.
Okay, thank you. Next item, update on board rulemaking proposals.
Yes. Our rulemaking proposals, we have a rulemaking proposal that was just submitted to DCA. It's our substantial relationship and rehabilitation criteria regs, otherwise known as the AB 2138 regulations. The department had asked that all of those regulations be submitted by the end of April. So we did submit those to begin the initial review process. They were submitted on April 18th of last month, so those should be moving forward now. Our other set of regulations, our enforcement process regulations, they are still in the initial review process. They had made it to agency, however, we have to put those regulations on hold while the AB 2138 regs go through because they affect the same section. You cannot run two regulations affecting the same section at the same time. So we've put those on hold. We're holding them in the initial review process. However, they will follow the AB 2138 regs. Our exam rescoring, application abandonment, and APCC subsequent registration, those were approved by the board in November of 2017. They began the initial review process in April 2018 and were approved and filed with OAL in January 2019. The public comment period has ended on April 8th of last month, and the package has now been submitted to DCA to begin the final review process. So first one we've had in the final review process in a while. Our supervision regulations, those were submitted to DCA also to begin the initial review process in April 2019. So those should be moving along as well. So that's the reg update.
Thank you.
And just as a quick comment, I want to tip my hat to Roseanne for all her work on the 2138 regs and to getting those in well before the deadline. We are one of just a few handful of boards that did that. So kudos to Roseanne.
And they moved off my desk on April 22nd.
Nice. All right.
Yay, Roseanne.
Yay.
Yay.
Just for clarification on the last item for the supervision regulations, so when would that be, when will we know when it's done? When's it cooked?
Well, it's in the initial review process. So this is, if you look at the attachment A, you see those, I think there are 12 steps. It's in that process, and then we'll get to notice them. And then if you flip that page, you'll see the next 12 or 13 steps that'll happen after they're publicly noticed.
So are we looking at before January of 2020?
Oh, before 2020?
Yeah.
Were we 19? No.
Oh.
I'm reasonably certain they are not going to be ready by January 1, 2020, although that would be our desire.
No, but I mean just like the process to be done, not that we can enact them yet.
No.
No.
No?
No,
Okay,
that's been the challenge with the regs.
Yeah.
Because you have to do these 13 steps before you publicly notice them. Then you do the public notice, it's a 45-day comment period. We respond to all the comments and then we submit the package back through the same 13 steps again.
Okay.
So if you look on the chart for our enforcement ones, which are the ones we had to pull back on, we submitted those for initial review in July of 2017, and they got to agency in September of 2018. So, and that's still considered the initial review process.
Right, we've not publicly noticed those regs.
So I get confused between law and regs. I know there's a difference, but in terms of the supervision stuff.
The law's there.
So the law is there, so the regulations are the meat, the details of it?
Pretty much.
Okay, so none of that is in effect yet.
So
nothing goes in effect till this is.
Well, I wouldn't say nothing. So AB 93 was the statute, and that allowed triadic supervision. It kind of beefed up the requirements and the responsibilities of supervisors. The supervision regs, they do things like change the coursework requirements slightly. I think it's a 15-hour course for everybody. Yeah. It specifies other continuing professional development instead of just courses every other year, I believe it was. It specifies the more detailed forms that supervisors and supervisees are going to have to sit down and sign off together. So it's a little bit more of the detailed work, but the triadic supervision and the responsibilities as supervisors that went into effect last year that we talked about with legislation, that's all in, and this is sort of the second piece to that. It's being done in regulations. Regulations are, the intent of them is to make statute more specific.
Right.
So that's what we're doing with them.
So I guess I'm not in my brain clear on where the line is drawn for all of this as I try to educate the Educators Consortium with CalPIC. So maybe, Kim, I can work with you on
why
that.
don't we talk about that? I think we can give them the general statutes and then, the specific cross your T and dot your I's. That's going to be the regulations. But I mean, there's certainly nothing that would preclude a supervisor from going ahead and moving forward with what we're trying to put in regulation. And by the same token, if somebody wasn't doing that, we could not hold them accountable either.
Right.
So
right now, just the statutes are in effect. That
I know, but
address
I don't know what's in statute. All I know is that what we
From
voted
80
on, and I don't know which part ended up in statutes and which
Right,
part
the
are
AB.
regulations. Yeah.
93 years.
So we'll go over that for
Okay.
sure.
Thank you.
Christina?
So just a quick comment, I'm looking at, the attachment B and the examination rescoring and, and then the subsequent registration fee. And so, for that particular bill, so it's, board approved it in November 2017. And, if we cannot pass, through in a timely manner, by the time, we get it done, then we kind of like started to, things become outdated. So I think it's important that I just want to put it in record that, that my concern that sometimes, if it's been taking so long, to pass these, regs and stuff, and it's ended up just creating more burden, for the board staff because of the untimeliness. So I just want to say on record that's all, that my concern and the importance of just, keep that moving.
Yeah. I echo your sentiments, but we where we have been able to have absolute control over it, we've been able to move it forward. I know that our attorney's been very good about the packages. I can only scream and squawk so much.
I think we are on the same boat.
We did share that when we
Yes.
met with legal. We did share that it was a concern.
It's outdated.
So now it's not just from our chair of the board, and I think we said it in
The
every
board-
meeting.
I
that we
think our
just wanna-
stakeholders have
Yes.
expressed concerns. I think we're amply on record.
Right, and then add that to all the other boards and bureaus that are doing the same process. There's just shy of 40 entities. They're all feeling the same pain.
Yeah.
Okay.
Yes, I know.
All right. Thank you. So I think that's the rest of the
That's all
rulemaking,
from
right?
me.
That's all? Yay!
Thank you,
Can I ask
Roseanne.
a quick question?
Yes, question.
You probably said it at the beginning of the meeting, but I missed it. Why did we pull Assembly Bill 1529 from the agenda?
I'll defer to Roseanne.
We pulled that one. We decided that that wasn't related enough. We thought it might be, so we put it on once the agenda goes up, if anything changes or we decide we can't, once it's up, it's final. We can't talk about it. And we thought we might want to, and we were waiting for some more information. There's also one that became a 2-year bill that was on there that we didn't talk about today.
I'm just curious. Thank you.
All right. Is there any public comment for items not on the agenda? Yes, Leah.
I just want to acknowledge Gabriel and Alex, and is Vika also on that list, for their hard work this last year and coming on and being new. I know they're not continuing, and I just wanted to thank them for everything that they've done and their contributions this year. And,
Thank you.
And we'll miss Christine. We'll miss Christine too.
Miss Christina. Any other public comment?
I just want to echo that we will miss you guys greatly.
Absolutely. Any suggestions for future agenda items? Leah.
I'm keeping us from leaving. I'm sorry. Hopefully this will be quick. Before I do this, I need to confirm something. When somebody is at the associate level and they pass that 6-year mark and they get a new number, do they have to do any CEUs?
No.
So I would like to add for a future agenda item, exploring continuing education in general and for law and ethics for people who have been associates for a long time, because I know we've had some associates for upward of 20 years and never continued their education, and while they're under supervision, that's not the same. So, yeah.
Okay. Any additional items proposed? Then with that, oh, that was a suggestion for future agenda items. Apologize. Any additional future agenda items? No, then with that, we are going to adjourn the meeting. It is 4:15. Thank you very much.